Good evening. Between 5 p.m. yesterday and 5 p.m. today, in the 24 hours that have passed, we've had in all 441 positive cases of COVID-2019 in Gujarat. Out of these, we are also happy to share that as many as 186 of the cases which were positive in all till now have got discharged today. 186 COVID positive patients have been discharged today, and we've had 15 patients who were suffering from COVID-2019 who have unfortunately succumbed to it and passed away today with COVID-2019 as the principal cause of death. There have been another 34 of them who have also succumbed to this condition, but they had the primary cause of death was not attributable to COVID. They were already suffering from serious comorbid conditions, high risk factors, and there were underlying serious illnesses, but they also got the infection of COVID-2019 and unfortunately passed away. As of 5 p.m. today, in the 24 hours that went by, as many as 4,984 tests have been done for COVID. We also want to share that given the serious situation emerging in Ahmedabad city with a view to completely taking care of it, today some decisions have been taken by the government. The additional Chief Secretary of Forests and Environment, Dr. Rajiv Kumar Gupta, has been given the overall charge of Ahmedabad Municipal Corporation. Additionally, Shri Vijay Nehra, the Commissioner of Ahmedabad, had come in contact with a COVID-2019 positive patient, due to which he has had to go on a 14-day quarantine. And in the meantime, Shri Mukesh Kumar has been given charge of the Municipal Commissioner Ahmedabad. He has taken charge and has also started his meetings with the local officers there. The Chief Secretary, Shri Anil Mukim, along with the Chief Principal Secretary to the Honorable Chief Minister, Shri K. Kailashanathan, they have actually had a meeting today with all the senior officers of Ahmedabad Municipal Corporation to review the situation and initiate all the implementation activities there. Similarly, to further beef and gear up the actions being taken in the fight against COVID-2019, the Additional Chief Secretary of the Revenue Department, Shri Pankaj Kumar, who was looking after the exclusive COVID hospital built at the Civil Hospital Medicity campus in Ahmedabad, has also been given charge of the overall supervision and monitoring of the COVID-2019 preparedness in the state of Gujarat. Now, if you look at the recovery rates and we look at the total number of patients who have got recovered today, the number, as we mentioned, is about 1381, which reflects a recovery rate of nearly 22.11%. 10 days ago, this was about 9.48, which means that in the last 10 days, we've had a 133% increase in the recovery rates. And in the days to come, we do hope that more and more patients who are suffering from COVID-2019 would recover and get discharged and go home. So we again would like to appeal to all of you to download the Arogya Setu app on your mobile phones. We'd also like to request all of you to take various practices and suggestions given by the Ayush Ministry to improve and boost your immunity. These range from sipping hot water through the day. It also means you can take natural sources of vitamin C to boost your immunity, such as lemon juice and amla and so on. Chavanprash may also be taken. And there is this concept of providing Amrit Pay or Ukala. This has been given to as many as 1,56 lakh beneficiaries. They have benefited from this. So there's a huge demand for this. Similarly, we are finding that as many as 7,98,000 people have spontaneously demanded and taken the Ayurvedic tablet called Samshamvati. This has helped them boost their immunity. And similarly, the homeopathy medicine called Arsenicum album of potency 30 has also been specially taken by over 96,68,000 people who have opted for this. And we're also rolling this out and providing these Ayush medicines in our quarantine facilities, and more important now, even in those COVID care centers which have asymptomatic but positive patients of COVID-19, and we are finding that so far this has been accepted very well by them, and we would be compiling the results and sharing that with you shortly. Today we've also taken a very important decision in Vadodara, and we would be replicating this elsewhere. It has been decided that all the registered medical practitioners of Vadodara would be designated as COVID consultants for home-based COVID care, and it is expected that about 2,400 private registered medical practitioners of Vadodara would help in the symptomatic detection and care of COVID-2019 patients who do not require facility-based care. We've had the third successful patient from the district of Valsad who got discharged today. So all these heartwarming stories are pouring in from our districts, and the district teams, our entire medical teams are working with a lot of commitment and a lot of involvement. Similarly, today in the meeting, the core committee meeting, which is also a high-powered committee chaired by our Honorable Chief Minister, Shri Vijay Rupani, we took a decision that in those hospitals where there is an emergency operation to be performed, if the patient is hospitalized in the same hospital, and if the hospital has a laboratory where the patient can be tested for COVID-19, they can directly do so without having to go through the gatekeeping mechanism of our government superintendents of the government hospitals. So this was a decision again taken today to facilitate those patients who require an emergency hospitalization and operation primarily, and who have been hospitalized in those hospitals which also have a laboratory which can do the testing for COVID-2019. Thank you.